Hey, and welcome back to This Week in Pharmacy. We are twerksing. This is a day of celebration. I had a absolute blast with my family on Thanksgiving. It was nice just to hang out. I'm a grandpa. I don't know if you knew that. I have 3 grandkids, and it's weird. It's weird to be a grandpa I don't feel grandpa-ish. I remember my grandpa. Adam, do you remember? You have a grandpa still, right? Or you have a grandpa?
No, all of my grandpas have passed away, actually.
My
Yeah.
mine are all gone as well. You're not a grandpa, right?
I'm not a grandpa yet. My the twins are 14 and the youngest is 12. But my niece, who we kind of raised as our own, she has a young one that just turned 3, and he is like our grandkid, and it is amazing. So we're getting a taste of it. He's not our grandchild, but we act like he's our grandchild, and we freaking love it. So it's pretty awesome.
How was your Thanksgiving?
A lot of turkey. In my family, the tradition was the stuffing or dressing, depending on what part of the country you're from. Is it dressing or is it stuffing? And my grandmother made the best in the world. And when she passed away, that was kind of our thing. We always try to mimic what she made. We can never make it exactly right, but we have tried for years. But just tasting that takes us back so many years, so many memories, all that stuff. So Thanksgiving is probably one of my favorite holidays. Absolutely, for sure.
Yeah.
Yeah, there's a lot going on. So
There's a chillness to Thanksgiving that I appreciate in comparison to Christmas. I still like Christmas, but there's more nervousness in my home around Christmas.
Yeah.
And a little bit more too much excitement in some ways, but I enjoy it. But there's a peacefulness and a chill to Thanksgiving that I really savor.
Yeah, it was a big deal in our family just because we all gathered and we just ate around the table, and it was at my grandmother's house, and there's just you're exactly right. It's peaceful. And a lot of people don't have a peaceful Thanksgiving, but we always did, and it's it's definitely my favorite for sure.
All right. Well, thank you for joining me on This Week in Pharmacy.
Yes, sir.
I don't know if you can you twerks? Have you ever tried to twerks?
I feel like it's unethical if I do that. Like it's not. Yeah, I could try to twerks if but I don't know that anybody really wants to see that. So
So funny. All right. Well, for people that are watching on YouTube live and on LinkedIn live and I think we're running on Twitter live and Facebook live, welcome to the show. This is Dr. Adam Robinson, my friend, Twerk's co-host. I hope we're going to be doing more of these in 2025 together, and really extracting knowledge that you have of being in the trenches as a pharmacy owner, and that's Saverite Drugs Incorporated.
Yeah, I'm excited. I mean, we've been talking about us hooking up and doing a lot of podcasts, and I've done some with you and some other ones for some other people, and I love the opportunity to sit and talk, and that's just kind of my jam, is just sit around and talk about what's going on and share the knowledge that I've had, learn from others. So I'm excited to see what 2025 has to offer, especially in the world of pharmacy podcasting.
Yeah. Well, we're excited what's happening right now in the reinvention of the Precision Health and PGX podcast. Quick story, launched the PGX for Pharmacists podcast in 2018, the very first podcast about pharmacists driving pharmacogenomics. And we had a couple hosts. They didn't really work out because they were not bending the ideas around the clinical of PGX. So we always look to Becky Winslow, Dr. Winslow, and Dr. Banaz Sarami to bring us good content. And what's really interesting about this episode this week is Becky's talking with Lexi Wenzel and Mary Wiseman about reimbursement, demystifying Medicaid coverage and reimbursement around PGX. And that's exciting because I've been waiting to hear about how do we get more tests done for patients that the physician and the pharmacist, or the pharmacist, suspect that there's a medication issue, and being able to move forward with this testing. Where are we at from your neck of the woods in the leveraging of pharmacogenomics?
We've been working on pharmacogenomics for a while. I actually had my fellow, he worked on that project, and a lot of people don't know, in my pharmacy, I have an independent pharmacy in Kentucky, and we have a functional medicine clinic inside of that pharmacy. And we thought that the PGX is going to be, it's very important what we're doing. And I've done my own genetics testing. I've done it on my children, and it is amazing what you can figure out about your health. The problem that we have in the independent pharmacy world is the medical billing side. And there are some states that are doing some really good things with that. Kentucky is working on that. They're breaking some ground with that. That's the biggest piece. So it's really difficult for us a lot of pharmacists have an issue with offering this to somebody and saying, it's going to be $400, right? Where they can go to their family practitioner and get it for free or get it through their insurance. But Medicaid does cover it in most states. And so if you can really sit down and focus on, getting your state or whatever it is to get where you're a provider status, there is an opportunity there. So if that is in your state, I implore you to really look into that, to try to get that provider status with Medicaid, and you can bill these. And finding a physician to sign off on them if you don't have it, or a prescriber. But they are super, super important. And I think the more that these podcasts are happening and more education, obviously people are realizing just how important they are. And it could be a game changer for a lot of pharmacies. I mean, if you get $400 plus from one, and say you're going to actually make 100, well, you do 10 people. I mean, that's $1,000. So that's really, really, really good money that we could do.
Heck yeah. And if you market it correctly and you start announcing it and you start talking about it, you get a public relations agency.
Yes. And it's education. It's education, because people don't understand why it's important. And if we can loop it back around to the medicine side and just show that, it's a no-brainer. You just have to jump through the hoops of trying to get the medical coverage.
Yep. It's not impossible.
Not impossible.
Shout out to all the owners out there. If you're interested in stuff like this, reach out to our team. We have a bucket load of pharmacists, and many of them are doing it. So reach out.
Yeah.
All right. Next up, sponsoring us with a ton of insight. And this guy, Scotty, and his family.
The Sykeses are they're legit.
They're like the Jedi Masters of accounting
for pharmacy accounting. Yeah.
Accounting. Yeah, but they're talking about pharmacy leasing, and they're talking about the difference between capital lease versus operating lease. What, just from your point of view, what have you done in the past with equipment upgrades and different stuff like that?
So, you get into that section 179 deduction at the end of the year, and getting your equipment and that kind of thing. So it is definitely, look, Todd, just as well as I do that the pharmacy world has been hurting this year. So there's not going to be a ton of people that's going to be making tons of money in the pharmacy world like they used to.
Yeah.
But man, if you're really needing that deduction, you can get into, getting a robot, getting some icons, whatever it is that you need, new computer software, new computers. And you really want to bite that bullet, you can deduct that. And that's a huge savings. We've done that a lot. And then you get into whether, how are you going to pay for it? Do you lease it? Do you finance it? How do you want to do that? And, the Sykeses, they have ample podcast and YouTubes and stuff on this topic. So I look to them for the knowledge of that, but it can really help you out when it comes to the end of the year tax situation. You get to get something, you get to write it off. You can save you a ton of tax money, and that's always a plus if we can get some tax savings in the pharmacy. That's a huge thing.
Absolutely. So I want to give a shout out to all of Pharmacy 50 award winners. You were one of them. What alumni are you? What class of pharmacy?
I was the first year you did it. So what was that, 3 years ago?
2001. Yeah.
No, hold up.
2020.
Dude, you're freaking me out. 2001, I wasn't even graduated yet. Yeah, the first year, 2021, I made that list, and I was out doing a lot of consulting and speaking at conferences, and I was floored that I was thrown in that list. And that's, yeah, I hang my hat on that one. I love telling people that I made that list. But it's awesome because there's so many people every year when I look through that list, new people that I just met or people I want to meet, right? And then there's so many of my mentors that always show up in that. And so it just, those people, if you're not on the list or you don't know any of those people on the list, get to know some of those people. Find them at a show because they will talk to you. We all talk to each other.
Absolutely.
And it's so important to grab a hold of those people, ask what they're doing. What are you doing? That's awesome. And so for you to put out these awards just tells everybody out there, these are the people you need to talk to.
Exactly.
To help your pharmacy.
Exactly. Like there have been 200 of you since the beginning.
Mm-hmm.
And we're just coming up to the fourth alumni, the fourth class of Pharmacy 50. I'm so excited. It'll be mid January. We'll make the announcement. We're going to have a live stream of the actual event.
Yeah.
We're going to have a party. But the reason why I'm so excited about this year is we've done so much in different spaces that we've never done in before. So we're really digging into specialty pharmacy and finding the pharmacists out there who are really making a difference in rare disease.
Yep.
Nadia Ahmad, who got the #1 spot last year, has just lit her world on fire. She's getting speaking engagements. Walgreens has given her recognition. She goes to schools now. She goes to schools of pharmacy because they want her to come speak. Like, she's written me over the years what impact it has had. She goes, when she won it, she was kind of excited, and that's great. She wasn't really sure what it meant. You know, it was a nice award to get. And then when she saw what happened, now she's like, holy cow, like, I get it. And I'm like, that's it. Like, we're trying to bring attention to the impact that pharmacists actually make and in their individual expertise in space and how important that is. So that's all what the classes of Pharmacy 50. And like I said, it was very, very proud that you were in the class, the first class, the OG.
Yeah, that's right.
Where we get you like a metal medallion.
Yeah, one of those big ones that spins like a wheel. Dude, that'd be awesome.
The OG class. Hey, I have a question for you as a pharmacy owner. So I just lost the post. I had it.
Goodness.
Let me get her. So Fiona is one of my friends. She was a Pharmacy 50 award winner. I think last year. She actually came from Italy for award, which was wild. But the reason I bring this up, as a pharmacy owner, when you look at the designs that she's putting out and the change from a traditional looking pharmacy that you and I grew up with,
right? And
all of a sudden now it looks like we're walking through a spa. Like, what's the rate of return from your perspective if you were I think it's about the market that you're in.
Yes.
And then attracting maybe even an upper level, maybe more skincare, or maybe more disease management, or maybe more supplement world, or what's those things that they sit people down and they give them like the
IV infusions.
Yeah,
we do that. Those
okay.
are fun.
Yeah, that's what I'm saying. Like, what if there was a section of your place that make people feel kind of zen?
Yeah. Oh yeah, for sure. So pharmacy design, we built our standalone store 2017.
Okay.
I can't believe it's been that long. And that was a huge piece. I actually reached out. I don't know if I reached out to her. I don't know if she was available yet. There was a firm out of Germany that used to go around to shows, and I reached out to them. They really had this spa clinic European style, and it was very clean, very open, very non-traditional, and I really liked that idea. And I pulled some of those pieces from that, what they had. I went with a very non-traditional pharmacy look in my store, more of like a lodge feeling. So I'm in rural Kentucky, kind of country feeling, fireplace, taxidermy, heck, I got all my time. And that's what I wanted. Woods, real dark woods, and leather chairs. Like, people come in, it was comfortable. So when they came in, it was totally different than what they were used to at old school pharmacies or chain stores, whatever it was, where you just kind of sit down on these hard chairs and just sit there, it's cold and whatever. So yeah, pharmacy design. So if you're wanting to redesign, if you're wanting to build something new, definitely go around and ask people, ask for pictures. That's what I did. I went to different pharmacies. I just walked in and looked, see what they were doing. I'm like, I like that. I like that. Do not be afraid to ask questions. But what she's doing, the stuff I've seen with her stuff is very clinic, clean, aesthetic looking. And if that's where you want to go with your niche, they're fantastic. That it's very, very awesome stuff. But it will change. People will come into your store and they will look at it, and if there's something non-traditional about it, they'll love it. They don't even know why they love it. They just love it because they knew you took time and to do something different.
It's very true.
Yeah.
Yep. Before I met Fiona, I did go to several pharmacies that took a holistic vibe approach, and they had candles and supplements and skincare, and it was very like lots of woods, lots of wood, lots of stone, silver, metal, very clean, but it also made me feel spa-ish. And they even had music playing, and they even had like an incense in the air that made you have this lemongrass kind of thing going.
Right.
Yeah, that's all sell. I mean, I know that community pharmacy is the purity of community pharmacies, the safety, the clinical, the pharmacological, but you're also a business. So you have to pay attention to the sizzle.
Yeah, you have to know what people are wanting. So it's real easy. Go to wherever people are shopping and look and see where they're at. And if there's a whole bunch of people in one type of store, why are they in that store? Where they're attracted to that. So see what they're doing, right? And try to utilize some of that into what you're incorporated into what you're trying to do.
Yeah.
There's a lot of really good pharmacy fixture companies out there. One of the really cool things I did is all my fixtures out front are on wheels. Well, I would have never thought of doing that unless I spoke with somebody. You can go just get shelving, but they're all on wheels. We can rotate them. We can do seasonal. We can change them. So everything's constantly moving around at our store. But see what people are into right now. They're into spa. They're into clinical and holistic. So that could be definitely one way to go down the road.
Hold on. Hey, my favorite ice cup is Sykes and Company.
My favorite is whatever water bottle I pull out of my refrigerator.
Hey, news. Bad news out of Baltimore this just came out, and 3 more Walgreens locations closing in Baltimore, and they're saying they're projecting 1,200 store closures over the next 2 to 3 years. We're already minus 7,000 to 8,000 stores, Adam, throughout the country, with a rising population of that crest of 350, 360 million people. So
right.
What say you about the future of community pharmacy opportunity per se?
We could go down the whole path of PBM reimbursement and blah, blah, blah. And sometimes we can be pessimistic, and that's okay. I'm optimistic about a lot of this. There's opportunity. Get with your local state pharmacy agency. So in Kentucky, it's KPHA, Kentucky Pharmacy Association, NCPA. See what's going on. What are we missing on? What are some new things that your state's come out with that you're not utilizing? And then think about what you're being underserved in your community. And you can do that. So example, very rural. I'm here in Kentucky. We have protocols in Kentucky. We're very fortunate that we have that. We have a lot of underserved population that don't have a primary place to go just because we're so rural. So we do flu and strep testing. And we do a lot of that, surprisingly. And I don't want my really good friend's office. I don't want his patients over here. They have somebody. I want somebody that doesn't go somewhere. And so with Walgreens and these other places that are closing, we're going to have pharmacy deserts. And so you're going to have scripts, which whether or not you make money on it or not. So if you're not making money on scripts, you need to figure out a different way to do some absolution on that for sure. And there's ample places to do that and people to talk to. But man, the things are trending up. I really feel like the pharmacy world there's people in in Washington that really have an eye on what's going on in the pharmacy world. I think we're going to have reimbursements that are going to get adjusted before long. We're finally making a stand. And there's new things that are coming out. So I know we got to break here soon, but the last time I spoke at a convention, I talked to them. I said, everybody is freaking out about these lower reimbursements and these opportunities. They don't know what to do, right? And the last time we had that was when Medicare D rolled out in 2005, and everybody was in a panic. So what happened? They weren't getting paid for 6 months. All these pharmacies were closing down. They were selling out. Well, who came out of that? What came out of that? Well, what came out of that were clinical services, things that pharmacists could do that we never thought we could do. So the same is true with this. Yeah, we're going to have to bite the bullet, and we're going to have to face all this junk that we've been facing for a couple of years. But what is going to come out of that? All these fantastic people that are taking pharmacy to the next level. So be optimistic about it. It hurts sometimes. It's a pain in the butt, but I'm very optimistic over the next couple of years that we're going to be doing things in pharmacy we never thought we were going to do.
I absolutely agree. This kind of leans into our next story. This is from Pharmacy Practice News. Once again, this just came out this week. Pharmacists' key role in the management of Humira biosimilars. And the only thing I ever learned about biosimilars was at a couple of the Assembia conferences that I go to, or NASP, that talk about biosimilars at these specialty conferences. And I did have an opportunity to work with Cardinal Health on a couple series about it, but I'm number one, I'm not clinical. Number two, I don't know applications. So what's the future of biosimilars look like from your perspective, Adam? And then more specifically, is there any community pharmacy opportunity to become an educator of what that means for the public?
It's kind of a tricky area because you get down, it can go in multiple areas, right? So we can get in the whole specialty side, which as an independent pharmacist, it always scratches me a little wrong when it says, well, you have to be a specialty pharmacist.
Yeah.
What does that mean?
Right.
I went to pharmacy school just like everybody else. You mean I can't talk to these people? I get it. I understand why they're doing it. It's extremely expensive medicine. They want to cross their T's and dot their I's. I get that piece. But yeah, so, or we can get into the whole side of biosimilars, whether or not they're equivalent, generic equivalents and all that kind of stuff, and rebates and all that. So the thing about it is more of them are going to be coming out. So stay up to date on your CE, stay up to date with understanding it. Make sure you're putting good practices in place in your pharmacies where you are following up with patients. You're trying to help them with insurances and so forth. There are some insurances, there are some manufacturers out there where you can go direct with them for biosimilars and specialty. They may only contract with 10 pharmacies across the country. Well, maybe you luck into one of those and you're the one person that's sending these things all over the country because you put into place good practices. So we're going to be seeing a lot more of these. Just be prepared to actually be a pharmacist, right? Like do the things that you were trained to do instead of getting caught in the mundane of every day, just checking scripts and all that. So just be prepared. Just follow along. Make sure you're watching, keeping up with the trends.
Yep.
For sure.
There was a model called Cloud Script back in the day by Ritu Patel, and she was actually on several of our podcasts. And when she was talking and when she was marketing Cloud Script, it was like people were like, "You're crazy! Like you're a nut! Like this is never going to work." Well, it did work. It kind of took off a bit. Now it's been gobbled up by I can't remember what company gobbled it up, but why in the world? I always think of the entrepreneurial spec, and I know it's if you had an extra $300 million to do stuff, we'd all be billionaires, right? But my idea is like, so I have 10 healthy pharmacy owners that all like each other. They're all friends. You guys get together at NCPA or wherever you guys get together, and you're people like Chris Antipas out of Pittsburgh, right? And he started a specialty pharmacy. So you guys all throw in some money into this fund. And then you start looking for opportunities, whether that be specialty, the expansion of home care and community pharmacy, the expansion of maybe a specialty pharmacy within your 10 pharmacy. It now becomes the specialty pharmacy for these 10 pharmacies throughout the country. But I tell you, if I were a pharmacy owner, the heck I would be just doing like one sector.
Right.
You can't do anything without capital and without money. But what do you think of the creative way of thinking like that?
Well, I love it. It's very entrepreneurial, and I like that. Pharmacy world is a little segregated, not segregated. What's the word?
Yeah,
We're a
there's
little yeah, there's this distance sometimes between owners. We all like each other and we all go to these shows and we all talk and we all text each other, but actually getting together and doing something is hard because we're so enthralled into our business. You're spot on. Like, it takes a ton of money to get into specialty.
right.
Or say you wanted to do a USP 800 compounding. That's a ton of money. So how do you do that? There is definitely some ways to do that, but I'm with you. There needs to be a better way for all of us to get together. Collectively, I went to Washington and with NCPA and spoke to our congressman, and one of them told us, he's like, I don't understand why the pharmacy world doesn't get together, almost like a union, and just tells these PBMs and all these other people what you all make the decision what you're going to do. And I'm like, I don't know why we don't do it either. We just never have. NCPA has done a good job of trying to get people together with the CPSN and different groups that are out there. But yeah, I would be very interested in some kind of collective co-op, whatever that is. There's pharmacists around here that need it. Example, we have 5 pharmacies. Well, one of them just works in compounding. One of them has a holistic clinic. So we use those pharmacies to help each other out. So yeah, I would be down with it. I would just have to figure out how that model works and who you're going to trust. And that's how you do it. So
That's right. That's very true. All right. Last piece of news comes from Pharmacy Times. And the title is Empowering Diabetes Care, the Evolving Role of Pharmacists. And once again, when reading down through this article, it goes through some statistical updates that are new since 2021, as well as some additional information around the domino effect of what happens with people that aren't managing it correctly, and now it's going to cause other diseases in our body. So it's pretty important. So I always think, once again, back to the community pharmacy. What have you done in the diabetes space, Adam? And do you think that there is a cash-based or a extra reimbursement element to building a aggressive diabetes management program within a community, that you can be doing more than just these medications, but you can involve the Dexcoms and you can involve the data analytics and the meeting up with them, and maybe have the community gatherings for people living with diabetes. But talk to me about the world of diabetes, and is there a business model to that?
there's definitely a business model to it. The first thing is how you're going to get paid. So that's the first one, right? Like, we used to hang our hat on, we could become diabetes educators and we can have these classes and bill insurances, and then people weren't getting paid and blah, blah, blah. So you have to look for those avenues. Where can I get paid? Are there cash models? Well, supplements are the big one. That's the first thing we can do. And then the testing supplies, you can get them super cheap. Now the Dexcoms and so forth, they're coming out with ones where you can buy them over the counter. They're kind of hard to find. We've been trying to get some in, but point of care testing is a big one. We just marketed that. You can come in and get your blood sugar checked. We can also check your A1C. That's a cash model we can do. So these patients are usually, more often than not, have multiple different issues going on. It's not just diabetes. They're going to have maybe some heart issue. They're going to have something else, nerve issue. So what you have to do is you have to sit down and focus. You have to educate your team. This is what we're going to focus on. Here's these supplements. Here's these point of care testing. Here's these creams, these salves. Maybe it's compression stockings. Maybe it's whatever it is. You have to decide what that is. It is out there. There are a ton of people that are doing really good with diabetes care and education. But for sure, you just have to sit down and figure it out what you want to do and train your team. That's the biggest thing. And you're never, I steal this from Chris Corneliuson, you're never offering a sale. You're never selling something. You're offering a solution. And some other people have said that too. But you're offering them a solution, so they get to make the choice whether or not they want to buy it. And more often than not, they will buy it. You just don't think they're going to, because internally we don't think they're going to. But there is definitely a cash model for diabetes care.
Absolutely. And then just market it, and people that have diabetes will send other people to it because they've already trusted you as their community pharmacy.
Yeah. 100%. Go out there, hug on them. That's my big thing. I always go out and hug on my patients.
Yeah.
What do you got going on? Let me show you this cool thing I just figured out. They may or may not buy it, but then they're going to tell somebody about it.
Yep.
And they're going to come in, do a couple social media posts, get your local guys, to start to like you and follow you. And you'll start to pick up some stuff for sure. Yep.
All right. Well, we've enjoyed having you as co-host for This Week in Pharmacy.
Heck yeah.
Got to come back and tell us what's going on. What's next for you in the rest of December and kind of into actually we're just in the eve of December, but what's going on in December other than the holidays disrupting business?
Yeah. We're going to go have our Christmas parties and take our teams out and do that kind of thing. I'm an avid waterfowler, so it's duck hunting season. So my kids and my wife won't see me very much. We're just going to be sitting down. I got a student now. We're going to be sitting down with him and talking about what are our goals for 2025. Where do we want to go? We've got some legislation that's coming up in Kentucky that's really going to change some reimbursement. So we have to do some analytics on that and see what that's going to look like. Some insurance plans we're not taking. So we're going to just play around with that and then set goals for 2025. That's really what we're going to do for the remainder of the year. And then hit January 1, hit the ground running, man.
Great. Next week, Adam, I'm having Rep Jake Auchincloss on the show. Representative Auchincloss, primary writer of the new HR 9096.
Look at you.
Fight back. Pharmacists fight back.
That's right.
So I'm excited about that episode coming out. So make sure you look on the lookout for it.
Heck yeah. And, just real quick, get with your legislators. You'd be very surprised how many of them love pharmacy, know about what's going on, and they want to help. So the more you talk to them, the more the better off we are, and the better chance we're going to have something changed. Get to know them.
All right. Listen, we're going to take a quick break, but when we come back, I have Claudia Hawley on. She is a fighter, and her and Julie are just smashing it up on TikTok. They have almost 50,000 followers, and it's just accumulating. So she actually got together with Pharmacists United for Truth and Transparency, and Jeremy Counts got to celebrate the 50th sign on for the co-bill for 9096. So
nice.
When we come back, we're going to be talking with Claudia. You're not going to want to miss it. Hey, stay tuned for more on This Week in Pharmacy.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
Hey, and welcome back. This Week in Pharmacy. I'm your host, Todd Urey, founder of the Pharmacy Podcast Network. I have a lot to be thankful for. I want to say happy Thanksgiving to the entire pharmacy profession. We need some time off. We need time off with friends, family, people that make us laugh. Please, laughter. We are so excited today. I've been waiting for this interview because I am the whole social media thing as an entrepreneur. So Twitter, LinkedIn, Instagram, Facebook. That's about all I use. Now, I have a TikTok, but it's more educational because I'm more of a watcher. I'm pulling in information, pulling in data because of the rise of our healthcare professionals and our pharmacists on TikTok and the influence that they're having on public health and understanding and demystification of things. And they're just amazing. And with the Pharmacy 50 Awards, if you have someone that is a social media influencer, please go to pharmacy50.us. That's pharmacy50.us and vote for a pharmacist that's making a difference in our profession, changing things. And today's interview is about that. But what's even greater is that we're talking about healthcare professionals being influencers. What about people like myself, who has built my entire career and income for my family and my whole future on building a business to support you? So when I think of administrators and I think of billing specialists and I think of our pharmacy technicians and I think of marketers and support people inside doctors' offices, this is my interview today with Claudia Hawley. And she is a freaking superstar out on TikTok. If you don't follow her, you have to take this information down. It's Claudia Hawley. You can Google that. It'll come right up. She's getting very famous. And that's the TikTok is C_money 636. That's C_money 636. And right out of the gate, I have to ask, what in the world is up with that name, Claudia? Please give us the background. What is C-Money? C-Money.
C-Money 636. So we started out with Arthritis Center, obviously, and then we ended up getting a cease and desist from Cigna, Anthem. And I was trying to figure out, like, what about my freedom of speech? I'm not part of, like, outside of work, what am I? I could use my Twitter handle, CMoney636, which I copied from a coworker back in 2008 because his was CMoney314 and I was just teasing him. So I made mine CMoney636 and we just ran with it. So now CMoney636 is up and rolling and we're educating people on what's going on behind the scenes of their office visit at the doctor's, why their medication's taking so much longer than it used to.
Yeah, and what happened? Like, at what stage of your TikTok did all of a sudden things start heating up and you started getting thousands and thousands of views and followers, and there's been a couple that have gone viral and like that? You know, you've seen this taking place. TikTok's been around now for at least 3-4 years, so we understand what it is. But when you start becoming an influencer, what's that do to your psyche? Because you now. You know that saying from the Spider-Man movie that with great power comes great responsibility. So guess what? With great influence comes great responsibility. And you and Julia and you and Claudia, I mean, you guys are influencers now. And now you have an opportunity to actually freaking like punch people in the face. And I don't mean actually punch people in the face, but from a proverbial, like an example of just taking down the walls that are keeping us from being healthcare providers.
Julie just received an email from, I believe it was Aetna, and we have a go. Like, we don't have to do any prior authorizations for any PepsiCo employees because they got so sick of hearing us on every single social media platform. Because no matter what insurance you have, there's hundreds and thousands of members that are being affected by the same thing more than likely. And there's people that have a story that can relate to it. It's a matter of getting that story out and then people relate to it. And they're like, yeah, this happened to me with this insurance. And you just read the comments on these TikToks and it's like, it's happening everywhere. They're like, oh, you should see Blue Cross Blue Shield of Michigan. Like, it's disgusting how many people can truly relate. I'm trying to think. I've probably seen 3 comments in total that are like, I've never been affected like this from insurance. And it's like, well, tell me you work for a PBM without telling me you work for a PBM.
That's so true.
And I guess a year and a half ago, I want to say, we started with like 100 followers. And Julie and I just decided one of our videos, like, she called out Aetna, and she was like, she talked to this witch named Amy, and people just loved that. And that's the one that like got 1,000 views. And the next day I go over to Julie's house and we just record like 100 videos. I make her change shirts. We're outside. We're in her workout room. We're at the table. We make sure we have the books of like Marty McCary out in the open, or like, and we're just recording and posting them. And now if you look at my TikTok, the ones from a year ago are actually catching traction again. And it's funny because
you guys you're telling stories, and people want to get like the preface to how this all came to be. I love that you've used this to build where were things a year ago, and then all of a sudden we fast forward and you are you're getting hundreds of thousands of views, millions of views.
And it looks like smaller because I've been posting extra, but if you keep going down, it's hundreds and thousands of views. And Julie will even say that when she's trying to get someone's medication approved. She's like, listen, I'm on TikTok live right now. I've got 45,000 followers listening to you refuse to care for this patient. And it's not even a scare tactic. It's like, just provide the care that we're paying for, and there's nothing to be ashamed of. And one of my videos, Save on SP, it's got a couple 100,000 views. The guy messaged me and he goes, I'm in one of your TikToks. What do you want to know? And I was like, which one? He goes, I worked for Save on SP for 3 years. No longer work there. What do you want to know? And I was like, I want to know everything. Everything. Tell me everything. Because they can't explain what they're doing in a good way, a way that doesn't sound like they're siphoning funds to themselves, a way that doesn't sound selfish, because what they're doing is selfish. And I've personally had a friend that's been affected by it. She was paying $45 for us to fill out the paperwork, and they siphoned all the funds out of the copay card, and she was without medication. And it's because she had to sign up on Marketplace. She couldn't do research. She didn't have time. She was just kind of freaking out, and then had to go without medication. And it's like, when you have arthritis and you found a medication that works for you and is managing your symptoms, if you have a rheumatic disease in general, you're usually dealing with at least 3, 4, 5 other diagnoses. So when we find something that works, we don't want to change it. But these insurance companies have formularies that can change quarterly, and it's pay to play, whoever pays them the most. They shove down your throat that there's a biosimilar. But biosimilar is not biosame. And we've witnessed that full on with the whole Humira ordeal. And I mean, CVS, the auditor came in and I had to educate her because she said, no, these are all interchangeable. And I was looking at the purple book and I go, that's for syringes. We only prescribe auto injectors, and those are 2 different things. They're not the same. And she looked at it and she goes, you're right. You're right. I'll have to reopen this. And I just looked at Julie and I go, how terrifying that I'm not a pharmacist. I'm not the one that's auditing, that's for sure. And I had to point out that she overlooked the fact that it was syringes that are interchangeable, not the auto injectors. It's
So here's the thing. Here's the power of what you've done. And I don't know if you realize this, but I see things from a different view in some ways. And that is, I've been at this for a long, long time. I've been at this, since 2009, for God's sakes. And it was all about connecting people through content that were being sincere, that you could call bullshit on if, you could call them out. And finding out, is this about you? Is this about your fame? Or are you actually making things happen? You've proven yourself through the content development just in and of itself, because of the way that you have the interaction between the organization that should be doing their job, the patient, and then you as the care coordinator. You are providing care. You're connecting the dots that you're like, I know how to get a hold of this insurance organization, and I know I have the patient. I'm holding their hand right now. let's connect everybody. Why can't we be transparent about this whole thing? And that's part of it, Claudia, is we've not, as healthcare consumers, when I pay the thousands and thousands of dollars of my own money to get my health care, and then it's not available to me because you're not making enough profit. Like, that's the truth, though. That's the only reason it is that way. It's about that. It's about the profit.
Well, and I've made it my goal to be as transparent about everything in my life as possible. So people will ask me questions. People know my backstory. They know that I'm going to tell them how I feel and that I'm not going to push my beliefs onto them. They can choose whether or not to believe because I have evidence and I'm showing them what's going on, or they can choose to believe the insurance company that's continuously lied to them. And I mean, there are patients that do have full faith that their insurance company has their best interest at heart. And these insurance companies, in a way, have made it to where people don't even question what they're doing. I worked in the car warranty industry, and what's going on in the medical industry is grossly similar. The tactics for, these copay accumulators, like the patient must call in. Well, they want the patient to call in. That way they have authorization to blow up that patient's phone because the patient's giving them that by calling off of their phone. They now have the ability to call their phone as many times as they want without it being considered harassment. Like, that's the same exact tactic that happened in the warranty industry. And we just have to get people to acknowledge that there is a responsibility. Like, employers, you are responsible to make sure that your employees are able to get the care that they need. You can't just sign over a piece of paper while you're playing golf. That's going to affect thousands of your employees. And do research. Like, I'm not a genius. I've just worked in the field. This is their money. And Wendell Potter, for instance, he said they used to they call the employers cash cows because they could just charge whatever and the employer's not going to say anything. When's the last time an employer audited the funds that they were investing towards their medical policies?
Yep.
My best friend, she's HR with Penn Entertainment, and she doesn't have a clue about health insurance. She doesn't know anything. Isn't that terrifying? Like, that's human resources. That's the person you're supposed to go to if you have questions, and they can't answer your questions because they don't know.
Correct. And then where's the benefit? It's like, what do we think we're paying for? Who would do a study? It would take like drug channels and 43 Brooklyn, who are these nerdy data scientists who are actually part of PBM reform. They're being quoted in these state Medicaid cases and the shakedowns and Jake Auchincloss and like all of these people that are blowing it up finally are now being fueled and lit on fire from a messaging perspective by people like you, that you can bring attention to it to the consumer. Because here's the thing, it is so complex that the average me, I'm not going to say I'm an average consumer. It was very hard for me to understand how the insurance game worked for real and how PBMs were working for real and how they kept changing it. Algorithms, legal algorithms, as well as money flow algorithms and calling things specific things, medical formularies, and you got to put this one out first if it's not on formulary. And oh, by the way, there's the rebate back to the pharma companies, and it's just like they took control of something. And the layperson, Claudia, thinks drug prices are so high because, the pharma companies are making all this money. And I'm like, step aside. Like, please hold my beer and let me tell you the truth. It's the PBMs. It's the pharmacy benefit managers that started in the 1980s. And I knew the guy that helped start the one in Pittsburgh, rest his soul, Dom Meff from Greensburg, Pennsylvania, helped to start one of the original PBMs. And their sole purpose was to make sure that the patient's bill got paid. That was what did you hear that? That's all they were up to make sure that the patient's bills got paid. And I'm like,
Dr. Weisbart, he worked with Express Scripts, and their sole goal was to make it more affordable and like push out generic drugs. Like it wasn't to a formulary, it was to educate people that like you can take this and it'll be more affordable. Now it's gotten twisted completely into you're paying 12 times more for a generic medication.
Yeah, exactly. I just mentioned Representative Auchincloss, who helped to bring out and write in the primary sponsor of HR 9096, the Pharmacists Fight Back Act. Jake will be on the show next week, so I'm so excited that I've lined up these superstars in our healthcare industry that are truly making a difference. And Jake is one of those. In the history of what we're going through, Claudia, and we've been waiting a long time for this, probably twice as old as you. When we were first talking about PBM reform in 2010-ish, and then all of a sudden it's really started heating up over that next 5 years, I felt like it was never going to happen. We were never going to get attention, and we were never going to get social media power. And social media wasn't even that big of a deal back then, just to continue to show you how old I am. But it's just like now you're using TikTok, freaking Claudia, to literally change the world and to help people. Like that's freaking amazing. Like, and you've stepped into this, and it's, now you have to think, hey, how do I use this to build the messaging and the strength of your organization, the business that Dr. Bat, is pronounced Bach. Dr. Bach has started. So now you have to strengthen that of what that's going to ripple effect for other organizations like yours. Other arthritis specialist organizations across the nation should be looking at a blueprint that's been formed by you guys as a way to bring attention to something. There's nothing wrong with strengthening your brand and strengthening your business. I'm doing it. I'm not a hypocrite. I live the drug life, right? I live the drug life, but it's not really about the drug. That's kind of like a double entendre. And it's like, okay, we're here, right? This is my profession. So I know I can do my part. My tiny little part is to bring more attention to you and show other arthritis centers. Are we partnering with our pharmacists the right way? Are we doing things with independent community pharmacy on purpose in order to shy away from what happens when too much corporate gets involved? I think there's a nice balance. I'm not going to say do away with national chains. We need them. We need them bad. We're down 8,000 pharmacies over the last 4 years. So imagine that. The population, Claudia, what, 360 million cresting, and we have 8,000 less pharmacies, and the population's not going down, it's going up.
Right. And it's creating deserts where people have to drive an hour to get their medication. Well, for my medication, if I had to drive an hour to get it, probably wouldn't get it. Partly because of my ADHD, mostly because of my ADHD, but also I don't want to drive an hour. That's ridiculous. And then to have medication mail ordered to you. And I actually witnessed how unorganized and dangerous that could be to consumers too. My brother, he was a Marine. He had to go through Express Scripts mail order medication. And unfortunately, he had to go through surgery and he became addicted to narcotics.
Yeah.
But all he'd have to do is call and say he lost his prescription, and they would just resend fentanyl patches, Dilaudid, all of these extremely strong and dangerous drugs. When he passed away, there were 4 half-gallon bags of pain medication, because he would say he lost it and they just resend it. And it's like, there's an epidemic going on for opioids, and it's hard to not think that they're part of it if they're just willy-nilly sending out prescriptions because someone says they lost it.
Just for a dispensing fee, all for the money, not for healthcare. That's all. That's a money move. You see, that's the thing. When you walk into good community pharmacies, independents, even good chain pharmacies, there's good chain pharmacists out there, and they pay attention to what's happening in their patient's life because they look through the computer. That people are like, why does my prescription take 4 hours or 20 minutes or 30 minutes or whatever? It's because the pharmacist is freaking making sure, number one, you're not going to die, and then number two, have you taken this anywhere else? Is this is this happening? Like, is this just about the drug and maybe you're reselling it? Like they're like these little, it's like FBI, FDA, research, a drug specialist, all built into one position.
A counselor.
It's counselor. Like, it's like, and that's you. So you're supporting your organization. You come at it from a arthritis perspective. Give us a perspective from the pharmacy side of things, from your perspective of like, how is this going to impact specifically the arthritis organizations throughout the country?
Well, as a patient, even, I go to an independent pharmacy. I go to Millbrook. I just recently met the owner and the guy that started it up, Poppy. He's like 91 years old. And I looked at him and I said, Poppy, your pharmacy's not closing if I have anything to do with this. Like, we're keeping you going. Don't you worry. We're sharing the message. And it's like, when you walk into an independent pharmacy, Claudia, how are you? What's going on? What's new? Have you taken this medication before? I just saw. Do you have questions? Like, genuinely asking. Whereas you go to Walgreens, you stand in the line, you wait in line for 2 hours, and then you get to the front just to find out it's at a central filling station. So you're not going to get it for 3 days. And for rheumatic patients, especially, or autoimmune patients, if they can't get their medication, we have to increase their steroid exposure. Nobody likes steroids, and that especially puts a lot of people on edge. And not to mention, wears away bone, just has horrible side effects. And if we just were to fold over and say, all right, we'll listen to the PBMs, I can't even imagine these people would build up an immunity to every single drug, because quarterly it's changing what they can take. And right now we're working on a 28-year-old for Symphony Aria. And she's a teacher, and we were on the phone with Blue Cross Blue Shield of Illinois, and the representative goes, listen, I deal with chronic pain too. You're just going to have to call back, press those numbers. You've done everything that you really can. But it's not enough. We're not going to be able to approve it. We can't show that it's really benefiting you. We want you to take this a lot more dangerous drug it's a black label. Take that first. Let's see how you react to it. And then if you don't have a good response to it, we'll go ahead and put you back on the Symphony Aria.
Holy cow.
So with rheumatology patients, if you're on a drug that's working and you stop taking that drug and then you try to go back on it, just like anything, you're going to build immunity to that drug, and it's not going to work as well. And it just brings me back to like when I was in kindergarten and they said, you don't want to take an antibiotic for just whatever reason, for a runny nose. You want to take it because otherwise a big like virus will go around and it'll be immune to the antibiotics that we have. And I'm like, so I learned that in elementary school. Why isn't that being used today? Like, we're just going to put all these different drugs into people's bodies and then be like, actually you're immune to everything now. And then what's their quality of life?
What drug is it? Is it methotrexate or?
It was Xeljanz. And that's especially dangerous for like a female childbearing years. If you want to have kids, you don't want to take it. And it's like these Fortune 500 billion dollar companies need to get their head out of their wallet and actually listen to the stories of the people that they're affecting. And that's one thing that, like, when I'm on the phone with them, I sit there and I'm like, you're affecting an entire quality of life. Like, this patient cannot get out of bed. This patient is in so much pain. She's having to have a substitute teacher go into class because she can't stand and she can't focus because she's in so much pain. But
so this is it here is Xeljanz, right?
Yep.
And it says small movement could become, what's that? I have a clip over here. Big wins with RA symptom relief. Xeljanz can help relieve joint pain, swelling, and stiffness, and help stop further joint damage. Used to treat adults with moderately severe active rheumatoid arthritis when one or more medicines called tumor necrosis factor TNF blockers have been used and did not work well or cannot be tolerated. All right, first of all, just from a consumer perspective, and you watch this fun video of this beautiful family, and it looks like they're getting ready for Thanksgiving, actually. If you're watching on YouTube, you will see the Thanksgiving preparations happening here on the Xeljanz page. That actually is good timing, by the way. So here's the thing. Like any medication, there's pharmacological, there's the world of titration, there's the world of taking a medication for a specific amount of time and then transferring to another one, and having a pharmacist and a physician and a team like yours work at lowering dose on over a period of time in order to get to something else. I saw it in the medication assisted treatment centers. I used to work for one that had 83 throughout the country, new season. And there was titration always going on and kind of like the balancing, but it was really dialed into what the patient was experiencing ongoing with lots of counseling. We're slowing down this process. We're paying attention. We're listening to the patient. And then we're matching that with reimbursement codes, CPT codes, ICD-9 code or 10 codes to dial into how do we follow the system's tracking of everything that this patient needs and then make sure that it's getting paid for. Okay. So technology infrastructure's increased, coding has increased, medications have increased, the number of NDCs that are out there have increased. And it's like, it's working less and less for the patient and more for these big organizations. And that's the way we feel as consumers. So we're not vilifying them. We're saying if your Xeljanz works as you are publicly stating on your internet website, on the interwebs, see how I'm starting to sound old. But if your Xeljanz.com talks about Xeljanz, stand up to that for the people that it's good for, because there's going to be people that it's going to work for. There's going to be people that it's not going to work for. There's a thing called a pharmacogenomics test, which cheek swab, you send it to a lab, and it tells you what medications you're going to absorb fast, which ones you're going to metabolize slow, which one. Basically, it's a map for pharmacists and physicians to literally map what's best for you based on your DNA, right? Pharmacists are trying to forward that. We have a whole show on it here on the network, PGX for Pharmacists. And so what you and I are saying as consumers, and what you're closer to the patient than I'll ever be. I'm on a mic. I'm on a microphone. You literally have patients in your midst that are arthritis sufferers. And if you knew that Xeljanz was good for Martha Smith, and not you, but I mean your physician team, right, and you tried it, and then all of a sudden she starts reacting to it, or what if she took a test and it says she's going to metabolize this perfectly? It's right in line with what the physician wants. Physician goes, let's Xeljanz it. Xeljanz, take the Xeljanz. All right, everything. Then if you're okay and it's working for you, that's amazing. Like that's pharmacology and that's pharmaceutical. That's the way it's supposed to be. But when you hijack it with putting it on a formulary for 100% of the people, and you hijack it with the rebate game, and you hijack it with not getting it pre-authorized unless it's saying this because of this code, it has nothing to do with what the physician said, it has everything to do with just wanting to stall and not pay out money. Like it's a game. It
drives me nuts because I even called to do my own prior authorization for my Adderall, right? I used to take Vyvanse. It worked great, but insurance didn't cover it. So now I'm on Adderall, whatever. I called and I'm like, well, first off, why are we waiting until I'm filling my medication to tell me I need a prior authorization? You're waiting until I need my medication to it needs a prior auth. And I was like, okay, I'll do the prior authorization. Like, I know my doctor, I know my medical history. You have my medical history in front of you. Hopefully, let's do this. And they're like, nope, you can't do that. And I'm like, I've been on this medication for 14 years. What would be different? What do you need to know? And I just kept going and I kept going. And finally, they're like, well, the quantity's approved. The medication isn't, though. The quantity for what is approved then? Like, you approved what? And so I just keep going. And then finally they're like, so we need your physician to answer one question. And I was like, what's the question? I'm sure I can answer it. The question was, have I ever had an issue with substance abuse? That's what was holding up my entire prescription.
It's just like, all right, it's not, I don't feel like it's real. It's like it's being manipulated by a system on purpose. And we don't get real health care because it's all this fake process to get us this. And then we finally get the care that we need. And then something happens where once again, the fingers of greed creep in to find another way to extract more money out of the system just to keep us from getting what we need that we paid for. That's all what I'm saying. Hey, Pharmacists Fight Back Act. We needed 50 sponsors. And I just want to congratulate you and PUT and Pharmacists United for Truth and Transparency and the NCPA and the APHA and all of these groups that have tried so hard to get this in the session so that it's not missed, so it gets more attention around it, so it actually becomes something that is passed. And I'm nervous because I'm just a nervous person, just like I'm nervous about a lot of things. By the way, ADHD, I'm actually a candidate for Adderall. And just from my own perspective, I don't think I was a good candidate because I tried it. And at first it was great. And then I think about my 60th, 90th day, I started getting these fingertip pricklies. And then my ears would feel that same way where it was very like a prickly kind of feeling. And I didn't like it. So I moved to specific gummies that are cannabis, but it's also CBD that kind of neutralizes things. And so it's not like a high thing. It's like you don't take this and feel high at all. It's just like it kind of just gives you a little chill out because of our ADHD neurons. Our neurons are just going bop, 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 and we have to do a whole bunch of things at the same time because that's what it is to have this. But this really gives me an opportunity to just, I don't give a crap. It's like you don't give a crap anymore about, and you're just like, I'm just going to focus on one thing and that's it. So
you'll have to send me those.
Yeah, I'll send you some. So it's from Cannabis Pharmacy, cannabispharmacy.com. They're really, it's good. I know those guys that actually run that down there too. But yeah, I'm so excited because we're seeing things happen once again in PBM reform that we've been waiting forever. And the Pharmacists Fight Back Act, co-sponsored now by 50 people in Congress, which is just freaking awesome. And this is going to affect everybody. Like, this isn't just, we're not just fighting for Pennsylvania or Arizona. Like, this is the nation.
I think this was the first moment that because I was almost in tears whenever we got the 50th one. I was like, holy moly. Because the first day we did like a marathon and we were on for 4 hours and we got 4 co-sponsors. And then we just needed the one more. And when I was calling Congress, they were saying like, they're off for Thanksgiving the rest of the week. And I'm like, well, that's not okay because I need one more person to sign before Thanksgiving. Like, what do you mean? And if you start questioning these representatives, they get very sassy. Like, not even the representatives, the intern prior to the intern that's answering the phone calls. Because I'm like, can you promise you're going to get this message how are you going to get it to Jason Smith? And they're like, oh, well, we will. And I'm like, well, that's not reassuring at all.
Exactly.
And this really, it just proved to me that like our voice is getting attention, and people are actually calling and like finding their voice, which is my whole goal, is to educate. Well, I made this whole PowerPoint for me and Julie because I'm like, what we need to do is just engage more with our patients. They'll be more educated, and then they'll feel empowered to stand up against their insurance company. Because right now, we're just sending them into a labyrinth with no direction. They call, they speak to someone, ask their title, and they're told PhD. Pharmacy help desk? What? But an older person wouldn't know to ask and be like, oh, you're, because like I was being a little bit snarky to this representative. And when I heard he was a PhD, I was like, oh, whoa, I am so sorry. I didn't realize I was talking to a doctor. And he goes, no, I'm not a doctor. I'm pharmacy help desk. And I was like, if I could have told my grandpa that before he passed away, he would have been so proud of me. Like,
Claudia, PhD, patient help desk. Hey, we have to share this. We have to share this. If you're watching on YouTube, this is going to be special. So
you all wait. It happened. Drum roll, please. Representative 1, Casamani, Arizona, District 6, which is Southeast Arizona, including Tucson, is officially our 50th co-sponsor. Motherfucker, yeah! Fuck yes! 50 co-sponsors! You heard it live here! God damn it! Fuck yes! Fuck! We did it, Claudia! Fucking Arizona! Way to come through, Arizona! Fuck yes!
Oh my gosh!
Woo!
People didn't think we could do it.
Oh no, they didn't think we could do it. Well, we shove that right up there.
Like, it makes me teary-eyed because it's so crazy. Like, these I know Jeremy sent out, he's like, don't open this in front of, like, if you're at the pharmacy, don't open it. Everyone will hear it. And then people in my office were like, is everything okay? And I was like, we got the 50th co-sponsor. Because awesome. Julie was telling me, she's like, even to get one co-sponsor is so hard, Claudia. Like, I don't know how we're going to do it. And I was like, well, we're just going to keep talking about it. We're just going to keep talking about it and dialing. And she was loopy one day, and she came in and she goes, first time caller, long time listener. And every time we called, I was like, Julie, I'm obsessed with that phrase. She's like, I don't know. It just kind of came to me. I was like, it was brilliant. Because we're calling, because how many people have called their Congress? I'd never called my Congress.
Yeah.
And to know you have that power and they're going to listen to you.
Yep. Yeah. Learn to use your Congress, just get them involved and support them. Like, they want your support. They need our support actually worse than we need their support in a lot of ways. But let's use them to push forward, and let's use them partner with them to get something done for people that are desperately in need of their medications and counseling and the right kind of services, and the individualism of healthcare has to come back. And our providers, Claudia, you, Julie, Dr. Bach, like, they want to do their job. And please, please, Congress people, please, senators, please, president and vice president, and whoever the new Health and Human Services director or whatever they call them, pay attention to what the people want and balance it. Because I know there's budgeting, and I know that people have to make a profit, but it doesn't have to be, like I said, bastardized to the level that it is, that there's just not any money left. And pharmacies are going out of business, and people's lives are being wrecked, and people are dying because they're not getting pharmacy care that they're paying for in the form of tax. So don't get me started. I want to say that it's been an absolute pleasure to get you on Twerks This Week in Pharmacy. So excited to have you here. This can't be the last time that you come. I want you and Julie to definitely come back. I think we'll have a Knights of the Round Table when we get after session is out, and we get to that next break where all the representatives go back to their home bases, I think I'll get a Knights of the Round Table. We'll put some people together and we'll see where we're at so that we can make sure that all this work that you've done, you, Claudia, all this extra stuff, all this extra time that you've put into this, that it's making a difference. And it's making a difference, but let's track it together.
Yes, absolutely. And I think that's one thing. When Dr. Bach passed away, he told Julie, he said, just make sure my patients can get care. Just make sure my patients are able to get care. And Julie could have easily sold our practice, easily. You know, that's what these insurance companies want. But we're pushing on Dr. Bach's legacy of never backing down, taking on the hard cases and running with them. We're using our voice and we're going to educate people and we're going to change healthcare. We're not going to stop until healthcare is fixed. Right now it's health profit, but we're going to bring back the care to healthcare.
Right. That's awesome. All right. Well, we want to say thank you so much to Claudia for being on the show. We have your back. If you need something, if you want connections to pharmacists, if you want specialists, if you want, some kind of other tie-in, we have hospital system pharmacists, specialty pharmacists, pediatric specialty. I mean, that you really just name something that you need some content development on, or sharing, or other show information, or something of how we can help you, and we'll be there.
Perfect. Thank you so much. I am so honored to have been on here, and it's so nice to put a face to you. Thank you so much for this opportunity.
Absolutely. Hey, listen, go to pharmacy50.us, share that link, and just get other people voting for pharmacists that have really done very special things to their communities, to their patients, to move the industry forward, and influencers too. There's influencers out there that we want to get more attention around. And we're on our 4th year, and we're reaching thousands of pharmacists that have been impacted by this. And we have 200 that have won since 2021, the Pharmacy 50. We add them all up. So 200 of them. And it's just like, it's becoming this tree that's just growing everywhere, and it's just sprouting, and it's just fun to see it impact. So yeah, share it when you can. Tell Julie. All right.
Julie will too. We'll have her put it out on that TikTok or Twitter.
Your TikTok. All right. Well, today on Twerks, we didn't get a chance to twerk, but if you want to give us a twerks just to end the year, and happy Thanksgiving, make sure we come back. And then we should get Jeremy on with his whiskey, and he does drinking podcasts, and we can get really schlossed up for the new year. Maybe we should have a New Year's Eve party of podcasters.
I think that'd be fun.
Yeah, I'll see what we can do. All right.
I'll be in.
This is Debbie Marcello, host of the Happier at Home PRN podcast. Did you ever consider all of the potential cash revenue that you're giving away? What if you were to learn about services and products that you could keep in-house as opposed to referring your customers out? On my podcast, Happier at Home PRN, learn from the experts who have expanded their services to increase revenue, earn out-of-pocket payments, all while increasing the quality of care in their community. Listen to our past podcasts and join us for future episodes where we focus on growing your pharmacy into a thriving business. And we're not talking about keeping your head above water. We're talking about wealth and the survival of your pharmacy.
Hey, and welcome to This Week in Pharmacy. If you are like me, you probably are preparing for the end of 2024 and making some changes to make things better in 2025. I know it's not December yet, but we're right there on the cusp, right here on the edge. Nicole McClure and Vincent Grippy, I want to wish you both a happy Thanksgiving before I forget, because I want to talk about marketing this whole time. So welcome to This Week in Pharmacy.
Thanks, Todd. Happy to be here, and happy Thanksgiving to you.
Same. Thanks, Todd.
All right. So been doing a ton of discussions with our clients, talking with their marketing teams. What kind of content are they going to be concentrating on to help support their ventures for 2025? The strengthening of our independent community pharmacies is really at the top of our list. We have 7,000 to 8,000 less pharmacies than what we did 3 or 4 years ago, based on the pharmacy deserts becoming even more serious to public health. So strengthening a pharmacy is it's like baking a cake. There's so many ingredients that go into it. But one of the ingredients and things that we're going to be talking about today is positioning and marketing and branding. And I'm going to start out with Nicole. For those listeners, if you don't know Nicole McClure with GRX Marketing, Nicole was just instrumental in much of our work and our partnerships with independent community pharmacy. And you have teams that rely on you. Your team's growing, Nicole, but just tell us GRX Marketing and the changes that you're seeing, and then coming to the end of 2024, how are you guys preparing for the new year?
Yeah, so definitely a lot of year-end calls with our current clients. I would say, given everything that's happening this year, I think the mood is good, optimistic in talking with our clients, just as far as preparing for their strategies for 2025. That's definitely shifted away from the normal pharmacy day-to-day that you would think a typical pharmacy would do. So it's, more focused on wellness, outreach, vitamins, and things like that, as opposed to just filling prescriptions. Because as you touched on at the beginning, it just doesn't work anymore to stay in business. So that's where we've definitely seen that shift in kind of that's not even really a focus. It's more on these ancillary type services that are now becoming kind of their core offerings.
Yeah, and it's cash-based stuff. So
right.
Thinking of our supplements, I'm thinking, do you have a condition that there is an opportunity to suggest a supplement that the pharmacist understands is either a detractor during that therapy? Maybe your vitamin C levels or vitamin D levels are down because you're on XYZ medication or something. And then how do you market that program? How do you communicate to your community? Hey, listen, this isn't just grab a bottle of multivitamins and you're off running. Is there something specific for absorption? Is there something specific for, vitamins or minerals or something in your body that's suffering based on the medication regimen that you're on? And then turn that into a marketed program that you'd think, how many of your patients, how many of the people that are showing up at your pharmacy don't even know that could be an offered program, that they could be talking to their aunts, their uncles, their friends, their grandma about that, which now becomes another way of marketing yourself. Word of mouth, still to this day, Nicole, has got to be in the top 5 ways of marketing your services.
Yeah, I mean, I think word of mouth is a little deceiving sometimes, because that messaging can also be coming from other outlets, whether it's in-store marketing or social media or whatnot. But yeah, I mean, and that's what we find a lot of times with working with pharmacies is they are doing some great things, starting these types of programs. But if you don't have the marketing behind it, it doesn't matter, because nobody knows about it. So that's where having that strategy in place is so important to really get these programs going. And another thing we try to hit at home is just, you can also start small, start with your current population base. I think sometimes people forget about, I've always got to go out and get new customers. Why don't you cultivate those that are already using your pharmacy? It's a much easier sell. So starting there, starting small, you don't have to totally go gangbusters, because I think sometimes with new programs, I mean, a lot of pharmacists don't like change. So easing into it, see how your new patient or your current patients like it. And then if needed, make any changes from there before you do like a full market launch.
What a contrast. Vince, I cater to the B2B market. So my clients are organizations, companies, even national associations that want to reach pharmacists and want to reach pharmacy professionals. That's a sweet spot for me. I very much want to follow the pathway that Nicole has taken, where she has companies that rely on her. She's teaching those companies, pharmacists, to market to her community. And then now she's going to business and organizations to teach them how to better market or better position. You and I, Vince, and we sit in that same realm with B2B because all of your reporting that you do, and by the way, for listeners, go to grippymedia.com. Once again, that's GRIPPI media.com for the information. But Vincent, share with us, you were on Twerks a while ago. We talked about one of your reports, but talk about using this information to educate ourselves to be better prepared for the new year.
Yeah, sure. So you kind of hit the nail on the head, Todd. Most of our clients, they're in the digital health space, all B2B, selling to providers, payers, employers, and what have you. And our latest report focused on inbound marketing trends that we saw in the digital health space in particular, although I'd prefer to give it a more negative title of pitfalls that we saw, because the inbound marketing practices that we've reported on are less than stellar, right? But flipping that coin to a positive note, there's a lot of opportunity. So long story short, and I'm sure you've seen a lot of this, is, we had encountered a lot of clients that we either worked with regularly or on projects that were investing so heavily in this inbound marketing model, purchasing CRMs, automation tools, producing content, attending conferences and what have you. And the ultimate goal there, right, at the end of the day, is to take all of those efforts and funnel the people over to the website and ideally convert that into a lead, which eventually turns into business down the road, right? So the problem is that everyone that we've been worked with, we kind of found the bottleneck was always at the website. They're not good, frankly. They're not built to convert. And I think that there's been this common idea that I've encountered so much in the space where, hey, let's hire a great web agency or something. You build the website, and just like Field of Dreams, they're going to come. But it doesn't actually work that way, right? You have to dump a lot of investment into a site. You have to actually spend the time and the resources on getting people there. So if you're going to do all of that, the least you could do is build the website right. So our focus has been, especially going into 2025, on just proper inbound marketing hygiene. Making sure that your sites are set up to convert, making sure that the hooks that you're putting out there to bring people into your site are targeted and that they're actually valuable. Because too many times you'll see brands sort of slip into this routine of, okay, we're going to talk about ourselves on this podcast, or we're going to go on a webinar, talk about our product here and there, and just post about ourselves, share press releases, and hope that turns into something. But a day and age with AI content, essentially just taking over the web as we speak, and in droves, you have to stand out and you have to build a brand. So I think that goes hand in hand with the idea of building a better hook to get people into your website, right? Building actual relationships with them. And then on the website, structuring it in a way so that it's sticky and that people can actually convert.
Makes sense. Nicole, what are you sharing with your clients when it comes to that and teaching them, hey, and you're dragging them kicking and screaming into, hey, you need a website back in the day. And now it's, hey, can we clean up this website that's been out since, 2009? But yeah, tell us about like what you're sharing with the ground level, teams that are out there, the independent community pharmacies, and based on what Vince was sharing, what needs to be tweaked to ensure that they're number one, they're being found, but number two, they're developing a relationship with their client base or with their patient base.
Yeah, I mean, we run into the same thing that Vince touched on with they build a website and they're like, okay, great. Now everybody's just going to magically find me on Google. and especially if they've never had a website before, and just explaining to them, it takes time to be found by SEO and for all of that. But so that's where we try to educate them on kind of just high level of how the process works with getting found on search engines. From the back end, we do all the SEO stuff, but then educating them on you have to promote your website. You can't just create it and expect people to just automatically find it. So that's where it's promoting it to your current patients, but also, letting new people are going out in your community and letting them know as well. Also trying to make sure they do value added type stuff on the website. It's not just go there to refill their prescriptions and then they leave. What else can we put on the site that's valuable for your patients, whether that's educational information or videos, hooks for selling OTC products or other things like that. So it drives people there multiple times beyond just when they're looking to refill their prescriptions.
What about content as form of those linking people back to the organization, whether that be e-commerce actions or getting them to come for an immunization or a flu shot? What kind of content is attracting the the potential customer, the patient, to the community pharmacy?
I think just educational, kind of straight to the point. I've found that kind of just shorter is better in some ways. They want to know, how does a flu shot benefit them and why the pharmacist recommend it. I mean, pharmacists are seen as health authority people in their community, so they want to know why they should do this, or what are the benefits of starting this vitamin or something like that. So that's kind of when we write the content for a website. It's, really positioning that pharmacy owner as that lead healthcare source and the recommendations that they offer. As far as e-commerce goes specifically, I mean, we do have clients that have e-commerce websites, whether through us or other platforms. And I mean, at this point, we're not seeing a ton of traffic on it. I think it's, unless you really, really promote it to your current customers and online, it's very hard to get traction because you're competing against, so many other different brands out there, especially if you're trying to do vitamins or something like that that are available through multiple places. And it's a challenge for pharmacies to advertise on Google because they need that legit script certification and things like that. So that's just an extra expense that they have to give up front on top of, the ad spending and whatnot. So I think as far as e-commerce goes, I mean, we've actually seen a little decline in those types of website requests. It's more about focusing on, again, back to their services and how they're different than other pharmacies in their community.
Ease of use, appointment making, prescription tracking. I'm still waiting for a pharmacy, and I don't know if there is such a thing, Nicole, you might know, where if you order a Domino's pizza, you can go to your phone app and you can...
Oh yeah, you can watch the progress.
Like pharmacist, like who's going to come up with the watching my prescription of exactly when it's ready to be done and have a text come back? But I guess that's more marketing GUI show off app or something like that. Be like, okay, prescription's ready now, and it's being the final review check. It's in final review. Vincent, what do you think came out of this report that surprised you that you're sharing with marketers, knowing that your client are businesses, but that's going to trickle down to, hospitals. It's going to trickle down to community pharmacies and long-term care pharmacies. But what came out of the report that you can share with our listeners that was really interesting to you?
Honestly, I think one of the more surprising stats, and there's quite a few of them in the report, and it's actually probably the most frustrating one, I would say, is the the lack of customer focus. On the digital health side, you could pop open just about any site and you'll see that the copy is primarily just focused on the technology itself, right? The service itself or the product itself. We actually found, so we reviewed 200 different digital health websites across 10 different verticals. And we found that only 14% of them were following this 80-20 rule that's so common to website building, which is where, 80% of the copy should be focused on, the customer, the patient, whatever. And then the other 20% more so on the business. So what we found on so many of these sites, and we were kind of playing a game where, you could pull any of their quote unquote value propositions for their products, for the business as a whole, any particular solution, and it's incredibly generic. It's almost impossible for us to guess who does what when you just pull it out of a hat, right? And furthermore, we always ask people to do things like, hey, schedule a demo, request a demo, or download this report. We found that only 29% of those websites were actually highlighting what value you would get by taking those call to action. So, okay, if I'm going to schedule a demo, what does that mean? What do I get out of that? What's the value? What am I going to learn by attending a demo with you? And just to kind of underscore how off base some of this thinking is, that I received probably one of the worst digital ads I've ever seen before on LinkedIn. It was for a digital health company. I respect them. They do great work, but the ad simply just said, instead of having to request a demo and sit in on a live demo, you can just watch our videos instead. Didn't say anything about what they did. There was no imagery to imply what they did. They were assuming that, whoever received that ad knew who the brand was, what their products were. And I don't understand how that's a value proposition in any way, and how you expect to generate leads that way, or at least meaningful ones. So I think, the complete lack of focus and understanding of the customer, where they spend their time, what resonates with them, is probably one of the biggest disappointments I found in the report, and where I think a lot of brands need help. And, just one last thing on that is I think, going back to the idea of what we just mentioned earlier about bringing people to your website and, giving them those hooks that we mentioned, right? If you're just looking at your clients, say their Medicare Advantage plans, like, okay, so we're just going to write, about Medicare Advantage. That's it. We're just going to write about Medicare Advantage, and only content that, is so on the nose that we can't be wrong, then you're approaching the content marketing wrong. They're not thinking about themselves in that way, right? And in broad strokes, they have interests, they have needs, and they're looking, for education. They're looking for value. And I think that this is where you too often just kind of see that being missed with these brands. And I think that it's not just missed in those hooks that they're offering people, but say, hey, you do stumble on a site for a solution because you read a press release or what have you. Are you at least capturing that, like that direct traffic? Or are you capturing the person who says, oh, I heard about this brand, let me look them up. And they go to the site and it's just you talking about your technology. And with that, and, again, I'd love people to actually go and read the report. You'd be surprised at the lack of supporting elements that these sites have, things like testimonials or case studies and product videos. They're just lacking across the board. So you're essentially asking your clients, or your prospects for that matter, to take a leap of faith on you, which that's not marketing. It's not going to work.
Thank you for that. So I want to give the listeners a homework assignment. Once again, just download this digital report that Vincent put together, the 2024 Digital Health Inbound Marketing Report. And then this is going to conjure up a lot of questions that you can bring back to someone like Nicole, for example, who is just soaking in all things community pharmacy, independent community pharmacy marketing, and really be able to use it as an exercise, use it as a way of preparing yourself for 2025, finding those sweet spots, finding what your patients and community really want, and then marketing it over and over and over. And, you know, I'm a hypocrite in saying this, Nicole, but we have to pick one or two things that they're good at and market those hard, and then change the marketing maybe once a quarter to see how your patient or your patients and your community is reacting to it. The reason why I said I'm a hypocrite is I think I do too many things. One or two things.
I wasn't going to say anything, Todd. I was going to stay quiet.
Yeah. Do not make flight arrangements while I'm trying to work on something else, or I'll put myself in the wrong city. And that has absolutely happened. Vincent, that's a embarrassing story that I was with Nicole literally on a call with her, and I made a flight arrangement, and I put myself going out of the city that I was supposed to go to at the time, and still don't know how I got through security with that.
You told them, hey, I'm Todd Urey. I need to get on that plane.
And they're like, go right ahead.
Go right ahead. It'll be all right. All right. So top 3 things, both of you, it's putting you both on the spot. If you were a marketer, if you're in charge of a budget, if you are a community pharmacy owner, and I'm thinking, what things do I need to tighten up to prepare for 2025? Vincent, let me start with you. 3 things that you can kind of shout out to our listeners that they should be doing to clean it up and get ready for a new year.
So first and foremost, I would definitely go back to what we were mentioning earlier, is just having that the inbound hygiene in place. So making sure that your website is sticky with the proper elements that will drive those conversions that we so often need, right, to run the business. That can include, building lead magnets, reports, anything, webinars, anything that would actually engage and deliver value to your ideal customer. I think having a content plan in place is huge. I think that one trend that you're seeing well before 2024, and now especially going into 2025, is the growth of video. And with more and more AI content being rolled out on the web right now, and that's not to say that YouTube isn't inundated with it as well. What's going to help you differentiate is it's not going to be a blog post anymore. And, we're also in a world where there's a ton of AI podcasts out there too, right? So you're going to really need to be human, and you're going to need to find a way to connect a content plan to a sustainable, a human plan to a sustainable content plan, right? How you can get in front of your customers, offer them experiences, offer them value, and give them a reason to turn to you and not the thousands of others out there that are probably, regurgitating the same stuff using a lot of the same tools that are out there. And lastly, I think the most important one, and this is one that I've been harping on with all of my clients, is multi-channel search. I think, it's really clear that SEO is getting a huge shakeup right now, not just because of the AI search engines appearing, but also, we've Google's, and we're still waiting on their penalties for their monopoly of the search market. So between that and also the trial that just wrapped up, their monopoly of the digital ad market, Google's stronghold in search is really going to get rattled. And I think the way people are searching right now on top of that has been evolving. Since ChatGPT, Search GPT has been out in just, a month and a half, it's already owning 4.3% of the search market, right? And at the current rate of its growth, this is not including any of the penalties that Google could get hit with in the meantime. By 2029, they actually could have a market share that's comparable to Google's. They can catch up, so to speak. So I think, taking search seriously and looking beyond just search engines, right? Looking at things like social media, podcasts. Podcasts are huge for search, YouTube. I think it's incredibly important because people are looking for information, and for many years, we kind of didn't have many ways to find it, right, outside of Google, or Google at least was front and center. But now there are tools and behaviors that are evolving and changing that landscape entirely.
Thank you for that. Nicole, you're up.
All right. And you actually just touched on this, so you stole my thunder a little bit, but it's important to pick just one or two focuses, because a lot of times when we talk to clients, they, want to do this and this and this and this, and it's too much. It's too much for the average consumer to remember and absorb. So just pick one or two things, whether that's the things you do best, it's new programs, it's a differentiator in your community, whatever it is, and stick to it. And to your point earlier, it has to be marketed multiple times. You can't just do something once and hope people either go to your website, come into the pharmacy. You have to be in it for the long-term game. Marketing, unfortunately, is usually not a short-term, it's a long-term game. So the next one would be creating a marketing plan. A lot of times I think pharmacies tend to be more reactive instead of proactive in marketing. So they're just reacting to situations, whether it's a competitor closing or they've decided they wanted to launch a new program or something like that. But the problem is if you haven't done any marketing at all, and then you suddenly burst onto the scenes, especially if you're in a heavy populated area, nobody's going to know who you are. So you've got to overcome that barrier too. So at least doing a little bit of marketing consistently is very important. But have that plan in place, stick to it. Don't derail from it. That would be, I guess, my third one is stick to your plan. It's easy to sometimes that shiny new thing that you want to market, or hey, I've tried it for a month or two and it's not working, let's abandon it. No, you got to just stick to it. So,
all right, listeners, you're going to focus, you're going to create a plan, and you're going to stick to it. And even if you take it in blocks of the year, your first, second, third, fourth quarter, you'll be able to easily map out what is working, what isn't, possibly make a slight pivot in something that you don't think is working. But the stick to it part isn't just about the individual campaign or marketing. It's just the overall commitment to marketing,
right,
messaging, and communications. Yeah, absolutely. I agree.
Right.
Anything to add before we wrap it up, Vincent?
No, I think we hit it on the head here.
It's awesome. I tell you what, we are committed to the success of our pharmacists. We have a sweet spot with the independent community pharmacies. If there are any questions that come up when you're listening to this podcast, I want you to reach out to us. I'll get you in touch with Nicole, get you in touch with Vincent. These are people that make their lives at dialing into marketing, communications, public relations, business development. That's my charge for the year, is just becoming a soldier for these organizations to make them more profitable so that they stay into business. And we try to get the grips of the status quo to not be that big of a deal as it was in the dawn of 2024 when DIR fees hit us in the head. It really did some damage to public health. It definitely tore down pharmacies that were out there that were critical for our communities. And this year is an aggressive year. This is not a sitting on the sidelines. There's a lot of planning that I'm hearing coming from the buying groups. The digital health platform iCare Plus from IPC is just it's just amazing. There's pharmacists now getting ready to market that program, to talk to their patients and say, listen, it's not the health systems alone. It's not the big insurance companies alone that have these tools. Your community pharmacy is digital and ready. And then like Nicole was saying, you got to stick to it. You got to market it over and over and over. And like I said, it's hard for me to even do because I always want the next shiny thing to on to. But I appreciate both of you. Vincent, we're going to have you back as you continue to come out with this amazing reports. I've downloaded and used the digital health inbound marketing report. I absolutely think it's packed full of information that could help even our community pharmacy owners really understand marketing from a different perspective and use it as a way to ask better questions and ask questions that you really understand why you're asking those questions about your website or about your marketing or about your inbound marketing plan. But regardless, want to thank you both for being here at This Week in Pharmacy today.
Thanks, Todd.
Thanks, Todd. Happy Thanksgiving.
Absolutely. You too. Talk to you soon. Hey, we'll play a message and we're going to be right back.